Diabetes is potentially the greatest health crisis facing our nation. If nothing changes, more than 5 million people will have diabetes in the UK by 2025, with 90% of them having type 2 diabetes. Diabetes is expensive with a huge financial and human cost, and GPs are overwhelmed, meaning they can't monitor their most at-risk patients. There is a large pool of potential health workers who are massively underutilised in the NHS. We propose one realistic solution that makes use of this pool, integrating the UK's growing requirement for flexible working with access to healthcare for those who need it most.
This is our GP dashboard. Here are some of our 50 type 2 diabetic patients who will benefit most from proactive monitoring and care. These patients will be assigned to healthcare providers that the practice have previously used, or to new healthcare providers depending on availability, expertise, geographic range, as shown in their profile. A view of profiles, training, capabilities and activity will be seen here. Let's assign Julie Thacker to Brad Pitt. On Brad Pitt's phone, you can see Julie Thacker, who's been assigned to us. She requires a diabetic foot assessment, and you see she's new, so you can call her and schedule an initial meeting. When you are ready, you can start the assessment. A template structure with all your measurements and checklist components required to complete the assessment will be shown, and then you will write up your patient notes and sign your name. On completion, the patient will be emailed for feedback and their appointment entered into their GP's EHR.
Our platform will help GPs by reducing workload on their services, help patients with an increase of diabetic monitoring, give healthcare workers opportunity to freelance effectively, and save the NHS hugely in future admission costs.
For rollout, we've developed a scheme where we move from concept to working model to working with local GPs in gathering evidence to approaching primary care networks or CCGs, and from that, if we are successful, resulting on onboarding of healthcare professionals.